Hello and welcome again in another video of Mind and Body Alternative Health Clinic from Birmingham. This video is not about diabetes. It's not about the causes or signs, symptoms of diabetes or how you can improve your condition. But this video is more about the future consequences or complications, associated with diabetes. Those who suffer from diabetes, especially for a long time, they are at higher risk of, end organ damage. So they must have a look on the key points which I'm going to share now in this very short video, that what could be the future complications if your sugar levels are very high, uncontrolled, or if you're taking your treatment, with different kind of wrong remedies, and if it is not properly, addressed. So this video is very important for patients who suffer from diabetes, or you've got somebody in your family. So please, if you like this video, you must share among your contacts as well, and also make sure to subscribe, like, and press the bell icon at the end as well. And also there's a disclaimer that this video is not intending to diagnose, cure, or assess any medical condition, but to give you some basic information. And if you want to make any changes in your treatment plan or in your dietetic alteration, you must speak to your GP, your health provider, or at least a qualified herbalist or homeopath wherever you live or in your locality. So let's see that what are the future complications or consequences of elevated or very high concentration of sugar in your blood. The first thing that we notice in many patients is called diabetic emergency, in which there's a sudden sugar hype in your blood, and that can cause a lot of organs damage. So you should always monitor your sugar level. You must have a glucometer at home and try to check your sugar level at least twice or 3 times a week, so you see that what is your sugar level, and you can take your treatment accordingly as well. Because normally when we check our sugar after taking our remedies, it should be around 5, 6, or maximum 7, or even in extreme cases it shouldn't cross 10. But sometimes we see that some patients, beside even taking their regular medication, their sugar level even crosses 20 or even 30s as well, and that is called diabetic emergency, and it can cause a lot of damage to very important essential organs in the body as well. So that is very, very important for you to keep monitoring as well. Another concern for many diabetic patients is called peripheral or neuropathies, which is the damage of your nerves. We've got a network of nerves in our body which takes message from your brain to various parts of your body, and then return those messages to your brain as well, and then we can react accordingly as well. And long term sugar can cause damage to those nerves, and many patients they have numbness, tingling, loss of some sensation, or pain throughout in their bodies as well, and that is due to damage of their nerves. Some patients they also complain that even they have no sensation in many parts of the body, especially around their soles or feet, and even on accident they put their feet on fire, they won't be able to feel any sensation because the end part of their nerves is completely damaged, unless they see that or somebody tells them that your feet on the fire, and then they react and remove that. But otherwise sometimes they completely burn their feet as well, because they lose sensation around their soles. Even such patients sometimes say that they feel they are walking on cotton or very soft surface because there is no sensation, and that is a very severe damage of sugar, and that is called diabetic neuropathy. Another concern for many patients is called cardio or peripheral vascular diseases, which means there's a damage of your blood vessels. We've got a network of vessels in the body, either arteries or veins, and sometimes there's a damage or complete destruction of your blood vessels, which can cause a lot of problems, including high blood pressure, and even it can cause stroke in some patients as well. One more concern for diabetic patient maybe in future is called diabetic retinopathy. Retina is a part of your eye, and severe damage to your retina can cause diabetic retinopathy, which can cause visual impairment, squinting, even sometime in severe cases you can lose your eyesight as well. Diabetic nephropathy relates to your kidneys, or about your nephrons, which is a unit of your kidneys, and its main function is to filter your blood and remove any waste or toxic materials from your bodies. But sometimes with long-term diabetes your nephrons get damaged, and it can't filter or it can't work properly as well. And many patients they complain that their concentration of albuminuria or proteinuria is very much higher. It means that their kidneys are damaged now, and it may lead to CKD, which is chronic kidney disorders or diseases, which may even end up in renal failures as well. So definitely long-term sugar can cause damage to your renal or your urinary systems as well. A very common concern, you must have come across is the skin problems. So many diabetic patients, they complain about slow wound healing, recurrent infections, ulcers, even gangrenes. And a very common term is used for many diabetic patients is called diabetic foot. That there's so much damage to their feet that they have to go for amputation. They have to physically remove, that part of the body from, that damaged area as well. So skin disorders is also very much higher, serious concern with diabetic patients. Some patients may also have, periodontal conditions, which means that is related to their oral cavity. It's about their teeth, about their gums. They may have gingivitis, recurrence, bleeding, pyorrhea, various kind of, oral health is also linked with chronic or, elevated sugar levels in the body as well. Some men and women, they are concerned about their sexual health. And yes, it is true, and it's very common with, men and women equally. For men, normally they complain about erectile dysfunction, ED, or, impotency. But in women, it could be more serious. So one of the conditions linked with high sugar is the loss of libido. So they don't have any desire for any sexual contact. Or if they do, they have a lot of, pain during, sexual contact. They also have a lot of, vaginal dryness. They are also more prone to recurrent UTI or water infections. And also they have got more chances of recurrent candida or yeast infection. So these are some concerns which are linked with sugar level, especially for men and women when they're concerned about their genitals or about their sexual health. One more problem which is concerned for many patients is called diabetic acidosis or diabetic ketoacidosis, when their sugar level is very low and their insulin level is very low and their sugar level is very elevated, and it can also be an emergency crisis because during that your liver produces something called ketones, and that can have a lot of complications in the body. So diabetic ketoacidosis is another further complication of uncontrolled diabetes. Such patients, they also complain about uncontrollable, urine. They've got frequent or urging for, passing urine. So they've got a kind of overactive bladder, which is also called urinary incontinence, especially at night time. Polyuria, so nocturnal, polyuria is very common. And that is also a long-term damage to your bladder, which is linked again with your nerves due to nerve damage or neuropathies of diabetes. Some patients, and it's a very common complaint, that they always feel tired, fatigue, lethargic, and also they have unintended weight loss as well. So if you observe that your weight loss is there without intention or without any planning, so it could be elevated or very destruction of diabetes in the body as well. Some patients, they also have poor immunity, so recurrent infections, recurrent hay fever, because diabetes on its own, it's an autoimmune condition, and with prolonged diabetic patients, they've got more weakness in their immune system. Your immune system is there to protect your body, but when it becomes weaker, it won't be able to protect, and you are prone to or exposed to a lot of allergens, and there's a reaction of immune system and weakness in there as well. When you have chronic diabetes, normally many patients, they cross their ages about 40 or 50, and they also understand that now it's a decline or degeneration of their body as well. So they go in depression, they go in some sort of disappointments in their life, they lose hope, and they're not interested. So they go in a lot of stress, depression, overthinking, and anxieties as well. So that is another concern with uncontrolled diabetes, because you can't see any improvement and your health is deteriorating day by day, and your life is getting worse. So if you don't want these things to happen in your life, you must always take your medication, your medicines regularly, which is being prescribed by your doctor or GP, and also you can take along some medicines or some natural remedies I'm going to share with you, so that can help manage your good sugar levels, and you won't be able to reach to those serious complications in life. Normally now everybody wants quick fixes, and most of the time some patients they go online, they Google a lot of things, they look at shorts on TikToks or YouTube, and they follow various kind of home remedies from unqualified or unprofessionals, and as a hope that they would control their sugar level, they try everything, and sometimes they go into a condition which is called hypoglycemia, which is a very low levels of sugar in your body, and that is also equally dangerous dangerous or a serious concern for you as well. So you should always try to monitor your sugar level. It shouldn't be too elevated, it shouldn't be too low as well. So it should be normal, it should be in a level which is not too risky or dangerous for you. So these were some of the future complications which I shared with you, about 15-16 different points. And if you think that you have a tendency of these conditions, you must definitely take some serious steps now and protect yourself from these problems in future. Now viewers, I'm going to suggest some plants, some natural remedies, and if you incorporate these along with your regular medication, you'll see a lot of improvement or at least better management of your sugar level. So one of the things you can do on weekly basis, at least once or twice a week, take more okra. Okra is also known as ladyfinger, so try to take this vegetable, very important for you, not only for sugar but also it helps lower down if you are having high cholesterol in the body as well. So okra is a great vegetable which can help sugar and cholesterol control, and you should take it once or twice a week. Apart from that, many people know about bitter gourd. So bitter gourd is another vegetable which can be taken once or twice a week as well. And also try to include more olives. So olives, okra and bitter gourd, these are great vegetables which should be part of your daily intake. You can include them as your salads, or you can simply steam them, or boil them and take them as well. Don't overcook them, because if you overcook any vegetable, you sometimes lose their very useful ingredients. So try to steam or half cooked and take these vegetables for much more benefits. Now I'm going to suggest top 2 herbal supplements which could also easily be found in your kitchen as well. But if you can't find them in your kitchen, and if you prefer, you can buy their supplements which are available on many herbal shops, or you can buy online as well. So one of the supplements which is great for many diabetic patients, for many other concerns as well, is called fenugreek seeds. So fenugreek seeds supplements can be considered along with your medicines once a day. And another great cinnamon from your kitchen is called cinnamon. So cinnamon and fenugreek will provide you additional help if you suffer from chronic diabetes, and they can help lower your sugar levels. Again, if you want some additional benefits, you may consider some supplements, daily supplements again, but speak to your doctor before you taking or changing any dietary or supplementation of your body as well. So one of the great supplements combination is called B6 and B12. Remember that vitamin B1, B6 and B12, they're considered to be neurovitamins. So they improve your nervous system, they repair if there is any damaged nerve, especially vitamin B12. Normally we go for its injections as well. It's very great, especially when you suffer from numbness and tingling in your body as well. So it can help repair any damaged nerves, and it is also known as cyanocobalamin. So you can consider taking these supplements once or twice a day according to their strength. If you suffer from a lot of body aches, especially cramps in various parts of the body, another great mineral is called magnesium. So you can also take or consider that. And one more mineral which is very helpful just to neutralize or balance your sugar levels. If it is too high, it will bring it down. If it's too low, it may elevate it slightly, and that is chromium. But try not to take these supplements more than 2 or 3 times, 2 or 3 months. The maximum level is taking these supplements once or twice. Must look at the recommended daily allowance, which is called RDA, and take 1 tablet a day, but maximum for 2 or 3 months. Otherwise you don't need this these kind of supplements for the rest of your life. So these are additional support for diabetic patients. Now at the end, I'm going to suggest some homeopathic remedies. And those who know about homeopathy, or those who love homeopathy, they know that the homeopathic approach or concept is very different. In homeopathy, we have to look at the causative factors of any disease, and then presenting symptoms or signs of the patients as well. That that many diabetic patients, they come or they have different kind of symptoms. Some patients may have dryness in their mouth, a lot of thirst, a lot of urination. Some may have skin problems. Some patient may simply suffer from neuropathies. Some may have some burning sensations in the body. So different diabetic patients, they may have different symptoms. So in homeopathy, we have to see that if a person with any medical condition is coming to our clinic, what are the causative factors and what are their presenting sign and symptoms, and then we try to match a remedy which can fix that particular sign or symptom. So it is just like a lock and key system. So if you tell us that You have soles burning, so there's a specific or different remedy. If you've got numbness, there's a separate remedy. So we have to use medicines according to your symptoms. But I'm going to talk about some of the top grade, 3 or 4 basic homeopathic remedies which can be considered by most of diabetic patients, because they will give you a general improvement in your condition. So one of the medicine in homeopathy is called Cyzinium jambulanum, and you have to use this medicine as in mother tincture. Mother tincture means that they are always available in drops. So consider these drops in some water 2 or 3 times a day, and you can take this remedy only if your sugar level is extremely high. You are in diabetic emergency. So take this remedy maximum again 2 or 3 months, and once your sugar levels are down, you can stop taking them. You don't have to continue with the same remedy for the rest of your life, but it can help only to lower very high or very elevated levels of sugar in the body. So take 15-20 drops in some water 2 or 3 times a day. This is also called black plum. So if you don't find this as in mother tincture, so you can look at your local market, and if you find black plums, you can simply take those fruits on daily basis as well. Another medicine which is very helpful, especially for patients who suffer or they have complain of extreme weakness, or also frequent urination, so they can consider taking uranium nitricum. If you complain about burning soles, which is another very common symptom of diabetic patient, the medicine that can help is called calcarea carb, and you can consider this medicine as 30 or 200 potency. So always speak to your local pharmacist and ask him or them to make these as pills, medicated pills. They put some drops on that, and that can be taken 2 or 3 times a day. So you can consider these remedies as a first line choice for diabetic patients. There is one medicine which we always give to all patients regarding any kind of symptom. So that can be helpful from sexual debility, from numbness, from mental sluggishness, from physical sluggishness. And that medicine which we give to every diabetic patient regardless is called acid phos. So consider this medicine as in 200 potency once or twice a day, and that will give you a general in totality improvement of your symptoms. So thank you very much for watching, and I wanted to share some very important information about the complications of sugar with you. And if you like this video, please take a note of some key points, and if you need some help, you can always get in touch. My clinic is in Birmingham, and if you need any specific condition or any peculiar sign symptom which I wasn't able to discuss in today's video, you can always contact me for advice. So thank you very much for watching, and I will speak to you soon with another very important video on another or any general topic. Thank you. Take care and bye-bye.